Friends, today I will talk to you about another commonly performed vascular procedure is called AV access for dialysis patients. AV access means arteriovenous access. There are different types of AV access. AV fistula, other conditions called basilic vein transposition, AV grafts, or different kind of catheters, temporary lines or tunnel catheters. Procedures are done to facilitate the dialysis for a long duration of time. For the patients of kidney failure, hemodialysis is like a lifeline. They should have a durable, an optimum, an ideal AV access so that dialysis can be done effectively, regularly on a long-term basis to improve a good quality of life. AV fistula means a procedure or an operation wherein artery and vein are joined together by a minor operation. Thereby, vein gets dilated, becomes big in size after usually 4 to 6 weeks time, and a hemodialysis can be performed through that matured vein for a long term. If veins are not suitable for AV fistula operation, in that case, many vascular surgeons would perform an operation called basilic vein transposition, wherein a vein called basilic vein is harvested from elbow to axilla, brought superficially, stitched to the artery so that a long segment of vein can be made available for hemodialysis. In some patients where veins are not suitable to perform AV fistula operation or a basilic vein transposition operation, or patients with a blocked fistula and BVT, there is another operation called AV graft. Graft means a synthetic blood vessel which can be used as a conduit, as a tube for hemodialysis. We usually prefer fistula, basilic vein transposition and AV graft in that order. There are good chances of infection, bleeding and a blockage with AV graft than with fistula or BVT. AV access operations may be a fistula, BVT or a graft. They might get blocked at some point of time. There are various reasons for it: inadequate outflow, excessive compression, poor quality vein, low blood pressure, an episode of vomiting or diarrhea. There are many such situations. In case of blockage of AV access, we also do an angioplasty called AV access angioplasty, which is like any other angioplasty wherein blocked fistula, blocked BVT or a blocked graft, or for that matter called central veins, are also opened up with angioplasty methods. To make AV access angioplasty a successful procedures, many times we have to use different modalities like plain balloon angioplasty, special drug coated balloons, scoring balloons, stents, covered stents and so on.